Okay, let me tell you a story. It's about a woman named Margaret. She was 74 and she went to her doctor for just a routine checkup. She felt well, she felt fine.
A little more tired than usual lately, sure, and maybe some indigestion that just wouldn't seem to go away, but, she just figured, hey, I'm getting older. Her doctor ordered an electrocardiogram, an ECG, just a standard part of the visit. But as he looked at that little printout, his whole face changed, and he looked at her and said, "Margaret, you've had a heart attack." Her response? "That's impossible. I never felt a thing." But here's the thing. It wasn't impossible. It wasn't even unusual. And what's really terrifying is just how common Margaret's story actually is. See, for decades, we've had this dramatic image of a heart attack, right? Crushing chest pains, someone clutching their chest, falling to the floor. But the real data, it tells a much quieter and a much, much deadlier story. You see, Margaret's impossible heart attack is the silent killer that is, frankly, walking among us. The Framingham Heart Study, this is the longest-running heart study in history, found that more than 1 in 4 heart attacks are only discovered on routine ECGs. The patients had absolutely no idea. And it gets worse. A more recent study. The study found that these silent heart attacks account for nearly half of all heart attacks. I mean, think about that. Half your heart muscle can literally be dying, cells necrosing, permanent scar tissue forming, and you feel nothing. Or you just feel a little tired, or your jaw hurts, and you do what we all do. You just blame your age. So today, we're pulling back the curtain on this invisible killer. Here's what we're going to cover. First, we'll dig into the shocking numbers behind what I'm calling the 50% invisible threat. Then we'll explore the mechanics of the body's broken alarm, like why don't you feel the pain? Next, and this is probably the most crucial part of this whole thing, we'll go through these 7 symptoms you absolutely have to trust. From there, we'll uncover the danger of delay and who is most at risk. And finally, we'll wrap up by equipping you with your 5-minute Lifesaver, a simple protocol that could literally save your life. Let's start with that number again, because it really needs to sink in. 50%. The ARIC Study, which followed over 9,000 people for years, confirmed it. Nearly half of all myocardial infarctions, that's the medical term for a heart attack, are silent. That means for every dramatic chest-clutching event you see in the movies, there's another one happening to someone who just feels a little off, or maybe thinks they have some bad heartburn. And I want to be crystal clear here. These are not minor events. That very same study found that having just one silent heart attack doubles your long-term risk of developing heart failure. It also triples your risk of dying from heart disease. And the Framingham study found that women are even more susceptible, with 35% of their heart attacks going totally unrecognized compared to 28% for men. So you may not have felt it, but believe me, the damage is done. Your heart remembers the scar. This risk also just explodes as we get older. For people in their late 40s and early 50s, the rate is about 2.4 per 1,000 people. By the time you hit your 60s and 70s, it's jumped almost 10 times to over 19 per 1,000. And for those 85 and older, it skyrockets to a staggering 46.3 per 1,000. The bottom line is, these unrecognized heart attacks are just as deadly as the ones you feel. The only difference is that nobody treated it because nobody even knew what happened. So this leads to the million-dollar question. Why? Why doesn't the body's natural alarm system go off? I mean, if your heart is being starved of oxygen and the muscle is literally dying, you should be in agony, right? Well, for millions of people, that alarm system is broken. So here's how it's supposed to work. Dying heart muscle releases chemicals that trigger pain signals. Those signals travel up these nerve fibers through the spinal cord and right to your brain, which then screams chest pain. But what if those nerve fibers are damaged? It's like a fire alarm with the wires cut. The fire is raging, but the bell never rings. The heart is in crisis, but the message just never reaches headquarters. So what cuts the wires? Well, the number one culprit is diabetes, specifically something called diabetic autonomic neuropathy. To put it simply, years of high blood sugar act like an acid on your nerves, just slowly corroding them. And this includes the very nerves inside your heart that are responsible for sending out those pain signals. This is exactly why the Framingham study found diabetic men had more than double the rate of silent heart attacks. Diabetes literally destroys the alarm system from the inside out. But it's not just diabetes. As we age, our nerve receptors just naturally become less sensitive. Some of us just have a higher pain tolerance than others. But honestly, the most insidious reason is something called referred pain confusion. The nerve pathways from your heart are shared with your jaw, your back, your shoulders, and your stomach. So your brain gets the distress signal, but it gets the address wrong. The signal says emergency, but the location says tooth. So you make an appointment with your dentist when you really need a cardiologist. It says stomach, so you take an antacid. You end up seeking every kind of help except the one you desperately, desperately need. Okay, this brings us to the most important part of our time together. If you cannot rely on chest pain, what can you rely on? You have to learn a new language, the subtle, quiet, atypical language of a heart in trouble.
These are the 7 signs that so many people dismiss as just getting older or a touch of indigestion. Please do not make that mistake. Number 1, unexplained crushing fatigue. This isn't just feeling tired after a long day. This is that profound exhaustion where the flight of stairs you climbed easily last week suddenly feels like you're scaling a mountain. 2, jaw or tooth pain. This is a massive red flag. If your jaw aches when you exert yourself, like walking up a hill, and then it stops when you rest, that is not a dental issue. That is a cardiac warning. 3, stubborn indigestion. This is discomfort high up in your abdomen that antacids simply do not touch. 4, shortness of breath, especially when you haven't done anything to cause it, or when it happens when you're just lying flat. 5, unusual sweating, a sudden, cold, clammy sweat that has nothing to do with the heat or exercise. 6, sudden pain in your back or right between your shoulder blades. And finally, number 7, a vague but powerful sense of doom, a deep, unexplainable feeling that something is terribly wrong. This is your most primitive alarm system, your body screaming that there's a crisis your conscious brain can't process yet. Trust this feeling. Recognizing these symptoms is truly a matter of life and death because the core danger here isn't just the heart attack itself, it's our delay in reacting to it. The time we waste wondering if it's serious enough, that's when permanent, irreversible damage occurs. And certain groups need to be on extra high alert. The 3 highest risk groups are first, people with diabetes because of that nerve damage we just talked about. Second, women over 65. One shocking study found that 43% of women having a heart attack reported no chest pain at all. Their number 1 symptom, unusual fatigue. And third, all adults over 75, where the risk, as we saw in that chart, just goes through the roof. And because these symptoms are so easy to rationalize away, people wait. One international study found that patients with these atypical symptoms waited on average over 12 hours longer to get to the hospital than patients with classic chest pain. 12 hours. When a coronary artery is blocked, every single minute, thousands of heart muscle cells die. A 12-hour delay is an absolute catastrophe. And this right here illustrates the tragic consequence. That same study showed the in-hospital mortality rate for patients with typical chest pain was 27.7%, but for patients with atypical symptoms, it was 42.3%. That huge jump in the death rate isn't because the heart attack itself was intrinsically worse. It's because the delay in recognition meant that by the time they got help, it was just too late to save the damaged heart muscle. The delay is what kills. So after all this pretty alarming information, let's talk about the solution. How do you protect yourself and the people you love? How do you turn all this knowledge into life-saving action? This is the Silent Heart Attack Detection Protocol. It's simple and it puts the power right back in your hands. Okay, if you are experiencing any of those 7 symptoms right now, your one and only job is to pick up the phone. Step 1, call 911 immediately. Don't worry about being embarrassed. If it's a false alarm, let the doctors figure that out. Every single paramedic would rather respond to 100 false alarms than miss one real one. Step 2, chew one 325 milligram aspirin as long as you're not allergic. Step 3, sit upright and stay as calm as you possibly can. And step 4, and this is crucial, do not drive yourself to the hospital. Wait for the ambulance. They are a mobile emergency room and they can begin treatment the second they arrive. Now let's talk about the long-term plan. How do you find out if you're like Margaret and maybe you've already had a silent heart attack? Step 1, and if you take nothing else away from this, take this. Ask your doctor for a routine ECG. It is a painless 5-minute test that can detect the electrical scars of a past heart attack. If you're in a high-risk group, over 65, diabetic, talk to your doctor about proactive screening. And finally, know those 7 symptoms. I mean, really know them. Internalize them. Print out that list and put it on your refrigerator. Make it visible for yourself and for your family. And if you feel hesitant or awkward about asking, here is the exact script. At your next checkup, just look your doctor in the eye and say, "I'd like a routine ECG. I'm concerned about the risk of a silent heart attack because I have diabetes, or because of my age, or because I've been experiencing some unexplained fatigue and indigestion." Be your own advocate. It is a 5-minute test that can reveal if your heart is hiding a very dangerous secret. So let's bring this all home. We started with Margaret, whose heart attack felt impossible. Now you know it's not just possible, it happens to half of all victims. You know your heart can be dying without that classic movie-style pain. But now you also know the 7 whispers it uses instead. You know who is most at risk, and you know the simple 5-minute test that can expose the truth. So please do not dismiss that crushing fatigue as just getting older. Do not dismiss that jaw pain as a toothache, and do not dismiss that stubborn indigestion. The 5-minute test that can save your life is an ECG. Ask for it. Ask for it this week. It might just be the most important question you ever ask.